A sore big toe sounds trivial on the face of it, a condition we see fairly frequently in clinic, and sometimes people are almost embarrassed to mention it. But it can actually be quite a limiting factor in terms of being able to walk and move around and do activities of weight bearing. Probably most people will be familiar with big toe pain that's caused from a bunion, and that's in a situation where when you look at the big toe, you see that it's pushed off to one side. And that usually represents a situation that's been occurring slowly over usually many years, where the pressure through the big toe has changed its position. And usually it's a result of the arch of the foot falling, so that the foot tends to twist in. And then the result of that is that it pushes the big toe outwards. And when that situation occurs, you end up with quite a lot of changes in the joint, and the soft tissues have got stretched, and it can be painful for two reasons. One, because when the toe pushes out like that, the prominent piece of the joint can tend to rub against footwear, so that can be pretty sore. But also because the joint isn't sitting in a proper position when you try and pivot off it, which should be the normal mechanics of walking and moving around. It's not able to pivot like a hinge because the joint's basically twisted. So that can cause a lot of pain too. So that would be, I suppose, the commonest recognized cause of toe pain. And that can sometimes be managed conservatively. Sometimes people use spacers in between the toes with variable success. Sometimes we used to spend a lot of time years ago working on trying to strengthen the foot muscles to try and change the fallen arch. But usually, if the joint has already become deformed, you don't really get a lot of success from doing that. And I've tried it many times over the years, so it won't correct the deformity. Sometimes it can reduce the pain, but won't change the deformity. And at the more extreme end of the case, people have a surgical procedure to straighten the toe out, which again can seem quite trivial, but the rehabilitation from that is quite laborious and often takes 4 to 6 months to get back into more normal walking. And essentially they have to break the toe, realign it with extra metal work, and to reconstruct some of the ligaments around the joint. So it's a complex procedure, really. The other common cause of toe pain is not a situation where the bunion has formed, which is technically known as a hallux valgus, but it's when the toe alignment is still okay, but the ability of the toe to bend backwards or to push upwards, that movement is called dorsiflexion. If that is restricted, then it means it's quite hard to pivot off the ball of the foot when you walk, which is part of the normal mechanics of walking every time you take a stride. And that usually happens, first of all, if you start to get some tightness around the capsule of the big toe joint. It restricts its ability to pivot, and then usually either it's a gradual onset with no specific history, or sometimes there's a new activity, typically hill walking or walking on a hill or running on a hill, whereby the extra angle of going upwards means that you have to pivot more off the foot and off the ball of the foot too. So if there is an underlying restriction in the movement of the joint, it gets exposed. I had a case fairly recently of somebody who aggravated the toe from pulling dinghies up a slipway for a few hours. So that caused some problems. So you can get, I suppose, a new or unusual activity that triggers an underlying issue. That's one kind of scenario. The other thing you would see quite frequently would be somebody with restricted ankle motion, again this dorsiflexion or pivoting motion in the ankle, and that can either be because of ankle joint stiffness itself, or because the calf and the Achilles tendon at the back of the leg are stiff, and that limits the pivoting motion through the ankle. And very often people wouldn't recognize that because it's not necessarily sore, it's just stiff. But the effect of the limited motion of pivoting off the ankle shunts the pressure down into the toe. So very often with treatment, we have to spend time working on loosening out the calf, stretching the Achilles tendon, and mobilizing the ankle joint to try and get the pivot in the ankle better, so that you can redistribute the pressure through the leg. So it's not the obvious immediate cause. Now, with regard to the toe itself, there's plenty of things you can do from a manipulation point of view to try and regain some flexibility. So generally what you're trying to do is stretch the capsule out, so primarily so that the toe can go into this extended position. And that obviously is an essential requirement to be able to pivot off the foot. Sometimes there's a combination of things whereby not only is the capsule of the joint become thickened, but you also get some extra bone formation around the margins of the joint. And that is a degenerative change. And sometimes that's a limiting factor in terms of how much extension you can get in the toe, because if you keep trying to push further, all that happens is you end up pinching these what are called marginal osteophytes, or little extra pieces of bone around the edge of the joint. And if that is the limiting factor and the cause of pain, then really sometimes that just needs a surgical debridement or a cleanup operation to try and take those extra bony pieces around the edge of the joint. So that's a procedure that's done for this type of a condition, what's known as hallux rigidus, or stiff toe in normal language. So sometimes that only surfaces as you try and get more mobility from the toe by manipulation and stretching and home exercise, and then you reach a point where it just doesn't go any further because you hit a bony block. And when that happens, then really there's no scope for physiotherapy to try and improve that anymore. People may try a cortisone injection into it, but again, it's a mechanical block. So usually it's more than just inflammation causing the restriction there. So it usually needs more invasive kind of management. In recent years, some of the more progressive surgeries that are offered now, I've seen people having a ball inserted between the two surfaces of the joint. So essentially putting a ball joint in, which actually acts as increasing the space between the joints, so that allows more pivoting. And I've seen older patients getting back running after that procedure. So that's still very much experimental, cutting edge, but it's a good procedure if you're at that stage of the scenario. But for a condition which can sound so trivial, it is quite limiting for people, and very often there's a lot you can do if you catch it in the earlier stages about changing the mechanics to try and redistribute the pressure. So that's obviously the job of a physiotherapist, is to dig deep and trying to find the causative factors, and also if the muscle control around the leg isn't good, so it's feeding into faulty mechanics, then they need to be addressed as part of a preventative strategy. So there's a few different interventions that are required in order to address the situation, and it's only a small proportion that end up needing a surgical scenario. So on the face of it, a condition that sounds quite trivial but can actually be quite limiting in terms of people's function, and again can usually respond to physiotherapy with a structured approach, as long as it hasn't gone too far down the degree of degenerative change. So I just thought we'd have that discussion, because we seem to have a few of those cases in at the moment. Hope you found that interesting. I'll see you again in another video. Bye for now.